My name is Lynn Poyen, and I'm the Director of Communications for the Town of Barnstable. Earlier this month, the Town of Barnstable was pleased to announce a new partnership with Advocates for Human Potential, Inc. to support the administration and oversight of the town's opioid settlement funds. This partnership will help ensure that settlement dollars are managed efficiently, transparently, and in a manner that best serves Barnstable residents while strengthening the town's capacity to direct resources where they can have the greatest impact. During 2024, we hosted a community engagement process to solicit input from residents, service providers, and community stakeholders who have been directly impacted by the opioid crisis. This process included a large facilitated community conversation, 4 focus groups, and 1 feedback session with the Town of Barnstable Opioid Settlement Fund Design Team. The input received through this process was incorporated into funding decisions. Since November of 2024, the Town of Barnstable has distributed $559,036 to 14 organizations. We anticipate an annual disbursement of between $150,000 to $200,000 going forward. Through this partnership, Advocates for Human Potential will support Barnstable with key elements of opioid settlement funding administration, including developing and issuing clear, accessible funding opportunities, facilitating fair and transparent application review processes, providing grantee coaching and implementation support to meet reporting requirements and performance expectations, and strengthening compliance, monitoring, and outcome reporting. Together, the Town of Barnstable and Advocates for Human Potential will work to ensure that opioid settlement funds are invested in ways that align with allowable uses, respond to community identified needs, and demonstrate measurable impact over time. At this time, I'm pleased to turn this webinar over to our Senior Program Manager and Team Leader for the Town of Barnstable, Kelly Joseph. Kelly?
Yeah, thanks so much, Lynn, and good to see everyone today. We appreciate folks taking the time to join us. So the goal for this informational session is to make sure that there is a shared understanding of this funding opportunity. As you all know, the session is being recorded and will be posted on the Town of Barnstable's website, as will any responses to the questions that we received today and during the Q&A period. So just for a quick overview of where we are headed today, we're going to start with a high-level overview of the funding itself and its purpose, including key dates and eligibility. From there, we're going to do a walkthrough of the application components along with some tips for each section. We're also going to touch on the application process, the review process, and the scoring criteria, and also an anticipated timeline moving forward. And we'll then close things out with some live Q&A. If you have questions at any point, again, feel free to drop those into the Q&A. My colleagues Sam and Beth will be monitoring that as we go. And just to level set up front, we will not be able to comment on individual project ideas or concepts. That said, we're going to do our best to provide general guidance so you all feel as informed as possible to determine your own next steps. Anything that we might not be able to get to live or we need to pull in our team to kind of help us respond to, again, we're going to capture all of that and include that in our formal Q&A responses that, again, will be uploaded to the town's website at the end of the Q&A period. So as Lynn mentioned, I work at Advocates for Human Potential, AHP, as a behavioral health consulting organization founded 40 years ago, right here in Massachusetts. It's always just really wonderful when we get to do work locally. And so we're very happy to be partnering with the Town of Barnstable on this effort. So Lynn already touched on this a little bit, but just to reiterate, Barnstable to date has been intentional and proactive in how it's approached opioid settlement funding. The town's oversight team has laid a pretty strong foundation through community engagement and initial rounds of investment. They have been really focused on getting this money out into the community where it can do some good. And my team has the benefit of really being able to build on that foundation and continuing some forward momentum into this next round as we bring some additional structure and support to the process. So I know at this point everyone is likely already pretty familiar with the opioid settlement funding, so I'm not going to do a deep dive into the specifics here. What I do want to emphasize is the town's role in stewarding these funds on behalf of the community and your role as potential awardees in delivering services and supports that directly address community needs. So the settlement funds themselves come with pretty clear requirements around how they can be used, right? Defined through the national settlement agreements and then reinforced through the state subdivision agreement. And we can drop a link to this document if folks are not familiar, the Massachusetts State Subdivision Agreement. In accessing its share of funds, Barnstable must adhere to that agreement. And what that means in practice is making, again, thoughtful investments that are informed by local input and aligned with the requirements in the agreement. This visual essentially just shows that flow, right? From the national settlements to the Commonwealth to the town, and ultimately to you all as potential awardees and delivering services directly to Barnstable residents. So to zoom out for a funding overview of the funding and priorities, I'm waiting to, slide control is giving me a problem right now. Beth, are you able to, here we go, perfect. So this funding is intended to support community-based efforts to address opioid use disorder and related needs across the full continuum of care. So that means prevention, harm reduction, treatment, and recovery. Proposed projects or programs or strategies, whatever you want to call them, must be aligned with the allowable uses as outlined in the state subdivision agreement, and they must be connected to identified needs in Barnstable. This round especially, are going to be paying particular attention to efforts that are clearly thought through in terms of the approach and ability to demonstrate impact. As for some of the specifics about the upcoming FY27 round, the total funding available is up to $200,000. We anticipate about 4 to 6 awards. Of course, this is going to be dependent on the amounts requested and by the awarded organizations. And individual awards are going to be capped at $50,000. Lastly, is funding beyond the current award period is not going to be guaranteed or expected. So what this means in practice for you all is that this funding is intended for something that you can realistically implement within the grant period. The town is certainly planning for additional funding rounds in future years, but the funding is not guaranteed year over year. And it's important that proposals that come through can kind of stand on their own. So I want to pause here to talk about some priorities for this funding round. The town wanted to ensure that community identified priorities that emerged during the 2024 engagement process that Lynn identified, that they're emphasized here. So these priorities came directly out of that work. So the full list is shown on the screen and it's also included in the NOFA. What I will say is that proposed projects do not need to address these areas, but there is going to be a preference for proposals that clearly align and address one or more of these areas. Applications that directly respond to a priority area identified here are going to be eligible for bonus points during the review and scoring process. And I'll share a little bit more detail about that in a little bit. So for this funding round, eligible applicants include nonprofit, community-based, and grassroots organizations. I do want to acknowledge that some of this language can be interpreted in different ways. So just to clarify, this opportunity is structured as a grant program, consistent with the town's approach to grant making and informed by Chapter 30B. So the intent is to support nonprofit organizations and community-based entities aligned with this model. So at this time, for-profit entities and government organizations are not eligible to apply. If there are additional questions or more nuanced questions or clarification needed, we can try to address this during the Q&A and if needed through email exchanges so that everyone can get answers to their questions. Additionally, eligible organizations should be able to demonstrate experience serving individuals or communities impacted by substance use disorder. And finally, proposed projects must be clearly focused on serving Barnstable residents with a thoughtful approach on how that population will be engaged. So before we wrap up this section, I just want to pause to highlight some key dates, just so everyone has these in mind as you're thinking about your next steps. So the application window itself opens July 1st at 9 a.m. and it's going to close July 30th at 5 p.m. Eastern. So a full month to be able to compile and produce your responses. All applications need to be submitted through the grants management system submittable, and I'll touch more on that later. The Q&A period technically opens today. So again, if questions come up as you are working through your application, you can submit those to the project email, which we'll drop a link to. And again, we will compile responses to any questions and we'll publish those on the town's website on July 10th so that everyone has access to the same information as you're preparing your applications. And then just looking ahead, award announcements are expected at the end of August, with the project period beginning in September and running for a full 12 months, so September to September of 2027. And just a bit of an aside to note, but during the project period, awardees will have access to monthly technical assistance. This is really kind of baked into our approach for all grant-related work, right? It's really designed to ensure that awardees have a designated point of contact to help troubleshoot questions and challenges. We know with the opioid settlement funds, there's a lot around reporting and compliance. And so we include this extra support to navigate implementation and help awardees stay on track over the course of their projects. So we're going to now shift to the application itself. So the first section is primarily administrative. It's going to include information about your organization, contact details, and a series of eligibility confirmations and attestations. This section is not scored, but it is required. So just to flag, incomplete responses here may prevent your application from moving forward. The main takeaway with section 1 is to make sure that everything is completed and accurate before submitting. This is all of the information that we will use moving forward, right, in terms of points of contact, key details about your organization. The next section is really about grounding the reviewers and who you are as an organization, right? You'll be asked to share things like your mission statement, the populations that you serve, and any relevant experience. Recommendation here is to focus on what's most relevant to the project that you're proposing, right? You may do a lot as an organization. We don't need you to necessarily include all of that information, but just the pieces that are going to help the reviewers understand your fit for this opportunity. I will note here too that all of the sections have word limits, and this is not meant to be restrictive, but rather to try to keep responses from you all focused and clear and concise to what the question is asking. Section 3, is really the core of your application, right? This is where you're going to describe the project or program or strategy that you're proposing. You'll include information about who you're serving, who the target population is, what you're going to be doing, and also how the work will be implemented. One of the biggest things I think to keep in mind here is alignment, right? Alignment with the funding priorities, alignment with the allowable uses of the opioid settlement funds, and also with identified community needs. Reviewers should be able to read this section and really quickly understand kind of what you're proposing and why it makes sense in this particular context. So this section focuses on the why behind your proposal. So why, what is the gap that you intend to address and who's impacted, right? You're welcome to include data if you have it. But just to note, community insight and lived experience are also valid and important here. So you can be sure to capture that as part of your response. Really here, we want to see folks articulate the need itself and help the reviewers understand why this work is necessary in Barnstable. So section 5 is outcomes and impact. And I want to spend a minute here because this was an articulated priority for the town for this funding round. This was something that we had some very early conversations about. So there's a really strong interest in funding projects that have very well-defined outcomes and a clear plan for tracking reach and tracking impact. Here, what we're going to be looking at is what will actually change as a result of your work, right? As a result of your project. What outcomes are you working towards, and how will you know if you've been successful? And I think this isn't really just about reporting, right? I think it's being able to tell a meaningful story about how Barnstable's opioid settlement funds are making a real difference for people, for families, and in the community at large. So the more specific and clearly defined you can be here, the stronger this particular section of your application will be, and the easier it will be for reviewers to really understand the value of your proposed work. So just want to emphasize the importance of the outcomes and impact section. So sections 6 and 7 are timeline and staffing. In the application itself, these are actually separated, but I've combined them for the walkthrough because I think they really go hand in hand. So these sections are about detailing your capacity and feasibility to deliver on what you're proposing. So you will outline your timeline, key activities or milestones, and then we've included a staffing table in the application where you can identify staffing roles, responsibilities, qualifications of different individuals. And importantly, each applicant is required to identify a clear project lead who will be the designated point of contact for your project. Again, as I mentioned, we provide what will be recurring technical assistance, and we want to make sure that we have some clear communication lines and some clear ways to connect with your project. Reviewers are going to be looking to understand whether the scope of your project is realistic within the grant period, and whether you have the capacity in place to implement it successfully. So really it comes down to making sure that there's a clear connection between the plan, project description, your staffing, and your overall approach. And then finally, the budget, nobody's favorite section. But we're asking all applicants to provide an itemized budget along with a brief narrative explaining and justifying the necessary costs. So again, our ability, when we do this in the submittable system, it gives us an ability to populate a template. And so everyone will be using the same standardized budget template. Submittable also auto-calculates tallies, which if you're like me and math is not your favorite, you don't need to worry about any manual calculation errors. As you put in your information, it's going to auto-tally for you. The template is organized into some core categories: personnel, supplies, equipment, travel, and with spaces to describe how these funds will be used. One important note here is that funds cannot supplant or replace existing resources. And again, this is a directive from the opioid settlement funds themselves. So just to give an example, if a program shifts staff that are already funded through a different means and shifts them onto opioid settlement funds and now uses those freed up funds elsewhere without expanding services, that would be a case of supplantation, okay? And with the budget overall, just as a general tip, I think consistency is going to be key. Reviewers should be able to really clearly see how all parts of your proposal are connected. The need, the project, the proposed description, anticipated outcomes, and the project directly. All right, so I just want to highlight that we'll be using a grants management system. Again, it's called Submittable to manage this process. So all applications need to be submitted there. If you have tried to access Submittable, again, it's not open yet. It will open July 1st. Right now, it has kind of a coming soon, Barnstable Opioid Settlement Funds. Again, as somebody who's not very tech savvy myself, I can say that Submittable is really user friendly. It's why we have chosen this for Barnstable. And we will share some link to some guidance if folks need help setting up an account. During the application window, so July 1st through July 30th, if there are questions, people have access issues, you're running into a problem completing certain sections, we will be available to help you troubleshoot that in real time. Just reach out to the project email. We can drop that into the chat again. And we can help support you through it. We want people to be able to navigate the system, be able to navigate and submit responses. So we're here to help with that process. So for this next section about the review process and scoring, I'm going to turn things over to my colleague, Sam Kennedy.
Thanks, Kelly. Hi, everyone. My name is Sam Kennedy. I'm part of the AHP team working with the town of Barnstable on this. And I just wanted to quickly touch on the review process and scoring. So looking at the application reviews, there we go. Sorry. Your proposals are going to be evaluated by a team of trained reviewers. And that team is going to include Town of Barnstable municipal staff and subject matter experts who know this content about the opioid settlement funds. Every application is read and scored independently by two separate reviewers using a standardized rubric. If there are any major variation in their scores, they sit down to discuss them and they reach alignment to make sure that the review process is thorough. And then all reviewers are going to complete a conflict of interest disclosure before getting their assignments. And if any conflict comes up, that application is immediately reassigned. The point here is transparency, fairness, and integrity. You are spending a lot of time on these proposals, and we want to make sure that they are fully reviewed in a fair way. And part of that is also transparency. So you'll see on the next slide the scoring numbers. I might need a little help moving to the next one, Beth. Thank you. So here is the exact scoring breakdown for each of the sections that Kelly just reviewed. It adds up to 100 points plus 5 bonus points. As Kelly mentioned earlier, I'll highlight again that first section, applicant information and eligibility, it's not scored, but it is a strict pre-qualification requirement. You have to complete this section in order to move forward. You can see the scoring distribution throughout here. And the thing I want to focus on is in that third area, project description and approach. There's 25 base points in that section, and then a possible 5 bonus points for projects that align with the community priorities that we discussed earlier in this presentation. But you can see the full scoring outline right here. If you have any questions about that, you can put that into the Q&A.
Thanks, Sam. I'm sure folks enjoyed a brief break from my voice. This is a lot of talking for me, so I'm looking forward to getting to the Q&A section. Before we do, I just want to lay out the full timeline from the application through award and into the grant period. Some of these are firmer dates. Some of these, again, are a little bit more of like estimations based on how we imagine the work will unfold. But again, starting with the application phase, applications open July 1st and close July 30th. From there, applications will move into the review process, which Sam just outlined, where they'll be reviewed and scored, and recommendations will be developed. Award announcements are anticipated at the end of August, and then the grant period will begin in September and run for 12 months. During that time, again, there will be ongoing monitoring and support, including quarterly check-ins and monthly cohort meetings. And just to say, again, this is really kind of the full life cycle of this process from submission all the way through implementation. So from there, from here, we're going to open things up for questions.